Welcome to day 2 of the Home Care 100 conference here in Scottsdale, Arizona. Today I get Kathy Ford, the Chief Product Officer from Trella. Welcome to the
Morning.
podcast.
Thank you. Thanks for having me.
Yeah. Thank you, Lincoln, for hosting us here today, but and Trella's a big sponsor of you guys as well. So, Kathy, what are you doing here?
Well, as similar to, I think, most everybody else, it's a great opportunity to hear from the thought leaders in home health and what's keeping them up at night and what they're looking forward to and challenges that they're facing. And also, of course, it's great to reconnect with a lot of our customers are here. A lot of our future customers, I believe, are also here. So just fantastic opportunity to sort of mind share with really the elite in this space.
That's awesome. What tell us more about Trella.
Well, for the one or two people that don't know what Trella doesn't do,
I love that.
we are the leaders in post-acute data analytics combined with intelligent workflows. So, we provide a platform that allows the post-acute agencies the ability to understand their market, understand sort of all the elements as it relates to metrics, so from clinical to financial to quality, to make the best decisions as far as growth and partnerships, acquisitions, things of that nature. Several years ago, we expanded our company and presence and moved into, we acquired a CRM and really understood the need to incorporate all this valuable data and arm the folks that are working with the referral bases and groups and provider space with tooling in order to be more real time and effective. And so we're continuing down that journey, Trella is, and we really see, workflow as the real opportunity to optimize and drive more efficiencies, leveraging technology to take away all those sort of low-level tasks that are super wasteful and don't drive the most value. So Trella is continuing on this pursuit to close more gaps as it relates to the continuum of care. And we most recently acquired another workflow solution, a discharge workflow solution.
What was it called?
Company is called Repisodic.
Yep.
And Repisodic actually sits integrated within the acute care workflow space. So integrated with the Epics and Cerners of the world, completely embedded into that flow for case management discharge teams to properly and really curate the options as far as where that patient needs to go for what reasons, and the right time.
That's awesome.
Right level of care.
So that's, you guys have completed the integration of that?
We have absolutely done that. Awesome. And it's really been a fantastic experience. Of course, engaging with our existing post-acute customers that are using Repisodic and enjoying the benefits there, but now really working with health system executives and understanding length of stay challenges and where post-acute, which is, of course, a lot of the topics that are being covered here today, where post-acute can continue to better partner and, sort of work more upstream as far as that patient journey.
It's awesome. What have you learned since you've been here? What's the biggest focus that you can see?
Predominant theme is data, for sure. Which is, of course, great to hear. There's a lot of noise to the signal as it relates to data because there are, just thousands of data sources out there, both, free and, platforms like Trella. But I think there's still a lot of questions and needs around what really is the most meaningful data, in what way, contextualized. Historical data, past trending data is really critical, but, also what's happening right now, and then leveraging that data to think about what might happen is really where this industry, needs, data to go.
Sure. Trella was historically a Medicare dominant data platform.
Yes.
And I think it had a reputation of that. And back when I was involved a lot with you guys on the board, we were really a Medicare data platform. You've changed that. Explain that to the audience here. How much Medicare Advantage data do you have? Medicaid, those kind of things, commercial insurance data.
So we not only have quite a robust data set of Medicare, of course, fee for service, but we also have acquired other data types as well to complement. So we have a very robust addition of commercial data as well, which also includes Medicare Advantage data. The coverage, it really varies depending on states, regions of the country, but we have a high percentage of coverage for that Medicare data in most areas of the country. And as far as data goes and Trella, we're also unique in that, we integrate with over 30 post-acute EHRs. So we have other data types as well that we leverage and surface through our applications in order to have a more comprehensive view
It's awesome.
of what's happening.
It's awesome. I didn't know there was 30 of them. I didn't know there was 30 EHRs out there.
Yes.
It's funny. Who's with you today? Who'd you bring to the show?
Of course, our CEO, Scott Tapp, is here, and Jess Chu, who's our EVP of go-to-market.
Yeah. What'd you do last night?
Last night, Jess and I had a dinner with a prospect, a major health system in the Midwest. So that was actually a fantastic conversation. And we left Scott and his wife to attend the party last night.
Yeah, we the party was actually pretty good from what I understand. And we saw most of the party afterwards. I actually was at dinner too, but Scottsdale's amazing to take care of you.
It's absolutely the best place to have an event like this. The weather's been phenomenal. This venue is great, and so
we learned yesterday from Jeanette, the CEO of Lincoln, it's coming back in 2 years.
Oh, good.
Yeah, so
that
in
is
2 more years
terrific.
we'll have another party at the house and hang out.
Excellent. Yes.
That's awesome. Well, thank you for joining us today. Anything else you want to tell the audience?
What I would say is, as for anybody that is looking at data and how it can help, the key about data, and especially my plea to my fellow vendors in healthcare, is data needs to be democratized as much as possible. That just data alone should not be your differentiator. Differentiate and disrupt in how you use that data, how you contextualize it, and where and at what times. And the more access that everybody has to data, the better it is for patients, the better it is for providers who are trying to treat those patients. So
if I want to buy your data and I'm not your customer, how do I get a hold of you?
Certainly go to TrellaHealth.com as the fastest and easiest way.
TrellaHealth.com.
Yes.
All right. Thank you, Kathy.
Thank you, Tom.
All right. See you soon.
See you.